my name is Stefan Bertog. I work for the VA hospital in Minneapolis, Minnesota, as well as for the Cardiovascular Center in Frankfurt. My topic today was renal denervation for the treatment of hypertension and other disorders with sympathetic overactivity. We all know that hypertension remains a significant burden to the individual and society. More importantly, for the purpose of renal denervation, 20 to 30% of patients remain hypertensive despite effective antihypertensive medications. Hence, other treatment options are needed. One such treatment option is renal denervation. We do know that the kidney is supplied extensively by sympathetic nervous fibers. We also know that interruption of these sympathetic nervous fibers can lead to a significant blood pressure reduction in animal models and now, more recently, also in humans. How does catheter-based renal sympathectomy work? We use a catheter that is inserted into the ostium of the renal arteries and a more flimsier catheter through that catheter into the distal renal artery. This is the ablation catheter through which we apply radiofrequency energy. The catheter is withdrawn in a stepwise fashion and radiofrequency energy is applied. The sympathetic nervous fibers of the renal artery are particularly sensitive to radiofrequency energy, or I should say more to the heat generated by the radiofrequency energy, and thereby the sympathetic nervous system is interrupted. What do we know so far about the results of treatment with renal denervation based on catheter therapy? We do know by two studies, the Simplicity 1 and Simplicity 2 trial, that there is a significant reduction in blood pressure at 1 month and 6 months, and now more recently we also know that this reduction in blood pressure is maintained up to 24 months. We also know that by further data from other studies that renal denervation can lead to ancillary effects, including, for instance, an improvement in glucose control in diabetics, reduction in insulin and in hemoglobin A1C. We also know that it has favorable effects on exercise physiology. Patients, for instance, were studied before and after renal denervation with exercise physiology. This demonstrated a reduction in peak heart rate as well as a reduction in heart rate recovery. We also know that it might be beneficial to patients with diastolic dysfunction and hypertrophy, as echo studies have shown a decrement in left ventricular mass as well as reduction in hypertrophy. We also now know that some of the Doppler diastolic parameters have improved after renal denervation. Finally, there are also some potential uses in patients with obesity and sleep apnea with hypertension. One such trial had showed an improvement in the severity of sleep apnea, measuring the apnea-hypopnea index. So I think to summarize, renal denervation has an important role for the treatment of hypertension, as well as for other disorders that are associated with an overactive sympathetic nervous system. Potential problems with this procedure are that anywhere you position a catheter and apply radiofrequency energy into a vessel, there is a potential for injury of the vessel. And I should mention that in the two trials that were done, there was one guide catheter-induced renal dissection which needed to be treated with a stent. Further, there was one renal artery stenosis that was, however, remote from the treatment site and was treated successfully with the renal artery stent. We do not know in long term how safe this procedure will be. Most data is restricted to 2 years or less, and the number of patients so far treated with it on a trial basis is limited. To conclude, I think it will be a promising treatment method for the future. Further studies are needed to support current findings.